The plan to repeal Obamacare stalls, and an expensive cholesterol drug reduces cardiac events, but is it enough for insurers? Welcome to This Week in Managed Care. I'm Laura Jost. House Speaker Paul Ryan pulled the plug on Thursday's planned vote to replace the Affordable Care Act after he and President Donald Trump could not find enough votes to support their plan, the American Health Care Act. Ryan scheduled the vote on the 7th anniversary of the passage of President Obama's signature law, but he could not bridge a gap between conservatives who thought the plan left too many ACA regulations intact and moderates who feared their constituents would lose coverage. Obamacare supporters have flooded congressional offices with phone calls and protested at town hall meetings, and polls show support for the ACA is higher than ever. Yet amendments to the House Republican plan, designed to win over conservatives, might have cost the plan votes if it reached the Senate. These included changes to let states add work requirements for Medicaid patients, an option to let states receive a true block grant for Medicaid instead of a per capita cap, a change added late Thursday that strips the ACA of its 10 essential health benefits and lets states decide what health plans must cover. An update from the Congressional Budget Office on Thursday found that the changes would have still cost 24 million people coverage, but cut the deficit by $150 billion, less than half the original bill. As This Week in Managed Care taped Friday morning, a vote in the House was expected later in the day. Evolocumab, the cholesterol drug sold as Repatha, significantly reduces cardiac events after the first year without any cognitive side effects, according to separate studies presented last week at the American College of Cardiology scientific session. But while many physicians were impressed with the results of the Fourier trial, many payers thought they were not enough to justify the drug's $14,000 annual price tag. Two separate studies presented at ACC showed that payers are refusing to approve evolocumab and another drug in the class called PCSK9 inhibitors. The studies found more than 3/4 of the initial prescriptions are rejected, although many decisions are later reversed. Commercial payers are more likely to reject prescriptions than Medicare, and cardiologists have an easier time getting prescriptions approved than primary care physicians. AstraZeneca, the maker of dapagliflozin, funded a study that found the diabetes drug class SGLT2 inhibitors may prevent heart failure in patients who have not been diagnosed with the condition. The study, called CVD Real, used health registries to examine questions raised by the EMPA-REG clinical trial, which found that another SGLT2 inhibitor, empagliflozin, reduced cardiovascular deaths and heart failure in hospitalization in high-risk patients. AstraZeneca's Dr. Jim McDermott explains the purpose of the study.
The first was following the results of EMPA-REG. We wanted to see if hospitalization for heart failure was actually a class effect for the agents. Secondly, we wanted to see if the patient population, if these effects were seen in a broader patient population. And then third, we wanted to see if this applied to the real-world setting. And so with these results, we did see that overall the reduction in hospitalization for heart failure, a 39% reduction in hospitalization for heart failure, and a 51% reduction in all-cause mortality was associated with a class effect. Secondly, we did see that these results were in a broader patient population. And what I'm saying is that 87% of the patients that were in CVD Real, which included 300,000 patients, 87% of those patients did not have cardiovascular disease. So these findings obviously are across a broader patient population than what has been studied in the past. And then third is that this does demonstrate a real-world evidence effect, that this is what's going on when patients are being given SGLT2s, treated with SGLT2s by their physicians.
For all of our coverage from the American College of Cardiology, visit ajmc.com. The American Journal of Managed Care is on the road again this weekend, bringing you coverage from the 22nd Annual Conference of the National Comprehensive Cancer Network in Orlando, Florida. The meeting is an opportunity to discuss new findings that result in updates to the NCCN guidelines, which payers use for reimbursement decisions. To follow our coverage, visit ajmc.com. For all of us at the Managed Markets News Network, I'm Laura Jost. Thanks for joining us.